Imagine a world where even your health is invisible, simply because no one ever counted you. Black women are 3 to 4 times more likely to die from pregnancy-related causes compared to white women in the United States. Yet, until recently, most major national data sets didn't even break down maternal outcomes by race. Data deserts aren't accidental. They result from systems that decide who matters and who doesn't. Missing recognition, missing resources, missing opportunities to save lives. They are ghosts in the machine of modern public health, and their absence has profound, life-altering consequences for everyone. But what if I told you that these numbers, the very foundation of our public health systems, are built on incomplete, biased, and sometimes dangerously flawed information? When these individuals are not counted, their health problems do not officially exist. Their suffering is rendered invisible, their needs are ignored, and the system designed to protect them fails them completely. Artificial intelligence. AI promises to revolutionize everything. It can analyze vast data sets at incredible speeds, identify patterns that humans would miss, and predict disease outbreaks before they happen. The very same AI that promises to save us is also at risk of making the problem of the missing millions. The peril is that we will place our trust in these seemingly objective, intelligent systems. Without realizing they are perpetuating old prejudices, a child is born into a state of invisibility. They have no legal identity, which is the gateway to education, healthcare, and social protection. They are systematically undercounted, not out of malice, but because the systems themselves are just not built to see them. Technology is often hailed as the great equalizer, the tool that will lift the invisible into view. But what happens when artificial intelligence built on incomplete or biased data becomes the new gatekeeper? The technology is only as fair as the data it learns from. When the data is biased, AI amplifies those biases, sometimes with life or death consequences. As we rely more and more on data-driven systems, the invisible millions risk falling even further into the shadows. The promise of AI is powerful, but without a commitment to more inclusive, accurate data, that promise will remain out of reach for those who need it most. Her son's illness is not just a personal tragedy. It is a failure of the entire public health system, a stark reminder that when we fail to count someone, we are denying their humanity. John is not one person with a chronic illness. I think he is a series of disconnected, expensive emergency events. The system sees the symptom, but it never sees the man. This lack of data has life and death consequences. Official data shows 0 recorded pregnancies, so no resources are allocated for maternal health. The AI has not solved the problem. It has provided a sophisticated justification for ignoring it. An official report might proudly announce that 95% of children have received their essential immunizations. If you were to include these uncounted millions, the true vaccination rate might be closer to 70%. This illusion of progress is particularly tempting for politicians and policymakers. A new generation of public health pioneers is championing methods like community-led surveys, where local residents are trained and empowered to collect data within their own communities. Instead of being passive recipients of aid, communities become active partners in their own health. They help define the problems, collect the data, and design the solutions. The fight for inclusive data is the civil rights issue of our time. It is a fight for the principle that every human life has equal value. Counting everyone is not merely a technical challenge. It is a moral imperative. The right to health is a universal human right, not a privilege reserved for those who are easy to count. When our public health systems fail to see a person, they are implicitly stating that some lives matter more than others. Signing up for an official record is not just a bureaucratic step, it's a leap of faith. Stigma, fear of surveillance, memories of past trauma. In communities with histories of discrimination or neglect, mistrust runs deep. Informed consent isn't just a formality, it's a bridge to trust. For many, stigma, fear of surveillance, and past trauma make official systems feel unsafe. These barriers are often invisible but deeply influential. Cultural mistrust plays a powerful role. If we don't count people, they don't count. But they should.